right, now that we've done the training for Keppra, I thought it'd be a good idea to just kind of make a video that you could access at any time and just kind of update yourself depending on how often you use it. Additionally, we will do quarterly updates until we get a better understanding of how often we use it to just make sure everybody feels comfortable with it. So the first thing I'm going to do is just kind of, basically I'm just reiterating what we've already done on training. So this is should be a good review for you. The first thing I'm going to do is just kind of go over the paperwork portion of it, and then I'll show you the hands-on portion of it, and then it will all kind of come together. So the first thing that we want to remind ourselves is that the Keppra is not a mainline drug. In other words, it's a piggyback drug. We don't mainline it like we do the D10, for instance. We spike up our regular bag, we start a regular IV, and then we shut that down and piggyback in the Keppra. Whether it's adult or pediatric, it doesn't matter. So just remember that Keppra is not a mainline drug. The Keppra bag looks like this. It comes in a foil. It's not controlled. There's 1,500 milligrams in 100 mils, and so when we look at that, it doesn't need to be refrigerated or anything like that. It looks like that. It's a small little baby bag, and when we use this on an adult or on a peds, we're always going to use a 10-drop tubing, and that's just going to make it really super easy for us as we make the drip rate for both adult and pediatric the same, so it makes it easy to remember. When we do pediatrics, we're going to use a Biratrol, and so the Biratrol that we use is this one that doesn't have any type of an IV ad set on it. That way you get to select your own. And so basically, when these come, remember that everything is open, so you want to make sure that you close all of the things before you start spiking stuff up into it. That way you don't have extra flow coming into this tube. But essentially what we're going to do is, in pediatrics, we're going to inject the amount of milliliters necessary based off of the PD card into here, and then fill up the rest of this with the saline bag that's spiked up here until you get to 100 mils. And then we're going to put a 10-drop on the end of it, and so essentially you'll have 100 mils in a 10-drop, very much like you will with an adult. And then I think the other thing to remember is always remember to consider Versed if your patient continues to seize even while you're using the Keppra. And then finally, when you start a Keppra dose, you want to finish the Keppra dose. Think of it kind of like a loading dose. So if you give your 2 doses of Versed, let's say you walk in on a pediatrics, you give 5 milligrams in one nair and the other 5 milligrams in the other nair, and then you've given 2 doses of Versed, it's time to think about starting to hang your Keppra drip. So we're probably going to give it sooner than we did with phenobarb, in the sense that we just kept on giving more and more Versed, and we kind of shied away from using phenobarb just because we know of all the complications that occurs. That's not the case with Keppra, so my guess is we'll probably go to Keppra a little bit sooner than we did with phenobarb. When you start the Keppra drip, if the patient stops seizing 30 seconds later even, you're going to finish off that dose, whatever that dose amount is. In the adults, it's going to be basically a full bag, and in pediatrics, it's going to be based off of weight. So we'll go over that. But just remember that when you start a Keppra dose, you finish a Keppra dose. If your patient continues to seize or re-seizes after your first dose of Keppra, you certainly can use a second dose of Keppra. Once again, if you start the dose, you finish the full dose. So it just makes it really super simple. All right, so let's talk about adult administration. We're going to use the full bag. So remember, we're going to use our standard bag. We're going to put we call this our main IV. Whatever you decide to use for a main IV is just fine. And then we're going to piggyback in our Keppra to our main line. So we would shut this down, and we would take our Keppra bag, and we would spike it into a 10-drop, and then this 10-drop gets piggybacked into the main line. And then we open that up, and we want to try and run this in 5 to 10 minutes. So at 10 minutes, 100 drops a minute on a 10-drop tubing with 100 mils is about 100 drops a minute. So on the very outside, you want to be no less than 100 drops a minute, which is about a drop every second and a half, a drop and a half every second. More appropriately probably is to open it up a little bit more aggressively and get about 120 drops or 2 drops per second. That'll get you down in the 7-minute range. If you open this wide open, even with a catheter on the end, it will infuse in about 1 minute 45 seconds, which is not the end of the world, but it's not what we're trying to achieve. So what we know in the latest pediatric study is they bolused pediatrics with 1,000 milligrams and had very little downside to it. They got a little agitation out of it. So just know that there's a wide variability in that keeps you safe in giving this drug. If you give it too fast by accident, it's not the end of the world. We'd like to be in the 5 to 10 minute range. So spike that into a main line, run the whole thing in 5 to 10 minutes. That's basically what that means. And use a 10 drop, that's the big key there. Okay, so that's all there is to adults. And remember that you can repeat that once if you need to. So next, let's talk about pediatrics. Pediatrics, we're going to get to the same spot as we were with adults in the sense that we're going to run at about 100 to 120 drops a minute, and that'll infuse it in about 7 to 10 minutes. So how do we get there is the question. So what we're going to do is we're going to spike up another line, but this time we're going to spike up just a regular saline line into a Biratrol. And we're going to make sure that all these things are closed off before we do that so we don't get anything in the chamber, right? And then on the bottom half of this, we're going to put a 10 drop on it. So essentially, if you think about this, we're going to infuse the appropriate amount of medication using the port here, needleless port, into here, and then we're going to fill up with this bag up here until we get to 100 milliliters. And then we're right back where we started with the adult dose, which makes it really super simple. You have 100 mils on a 10 drop. You're going to run it in at 120 drops a minute and get it in there in about 7 minutes or so. So that's basically the nuts and bolts of the pediatric dosing. So the next question is how do we figure out how much to put in this? And we made that super easy for you. What we've done is we've taken the current PEDS cards, and at the bottom of the PEDS card, you can see here, it tells you exactly what the dose is for this patient who's 13 kilograms and what that means in milliliters. And so basically you're going to draw up 26 milliliters. So now here, this is the difference in the sense that where you spiked the Keppra bag for adults, you're not going to spike this bag. Think of this for pediatrics as your draw bag. So we're going to just draw right out of this the amount that's on here, which appears to be 26 milliliters, and then we're going to inject that into the Biratrol first, and then we're going to fill up the Biratrol the rest of the way till we hit the 100 mil mark, and we're right back at the same drip rate that we were for adults. So you'll notice that each one of the cards, we've done the same thing on each one, so you can see that all of the doses are on the bottom. And initially we talked about giving 20 mils per kilogram, 20 mgs per kilogram, but other agencies within King County were using 30 mgs per kilogram, and we want to make sure that we kind of standardize that so that when the next PD cards come out and they have Keppra on them, they have the correct dose on them. So that's a little bit of confusion where we started out initially with our medication of the month test that suggested 20 mgs per kg over 10 minutes. Now we've moved to 30 milligrams per kg over 5 to 10 minutes. So just a little slight adjustment. So that is the nuts and bolts of Keppra. I think the only other little tip and trick that I might recommend is just know that on the Biratrols that we just don't use a whole lot, if you roll your clamp all the way up towards the top, you'll notice that there's this hard piece right here, and you can accidentally think that you got it closed down, but you really, what's happened is it's stopped at that hard piece of plastic, and stuff can still flow into the Biratrol. So make sure that you're actually on tubing when you close that down. And then on the other end is another hard clamp, and that hard clamp works on a thicker piece of plastic here than your normal soft rubbery tubing, and so because of that you can see that you can get these little kink lines in there. So if you have any problems with flow coming out of your beer trawl, you want to make sure that you just make sure that there isn't any kinks there and that you're closed up here appropriately. And then just remember that this is your air vent here, and if you're having problems with it running, you can adjust your air vent. So that's all there is on Keppra. I hope that's helpful, and like I said, we'll do quarterly updates. I'll come around and we'll do some hands-on to make sure it feels comfortable as we move forward. Thank you very much.